So as we walk through that, let's start with the topical. And this is just me. This is not InMode. This is not standard of care, so you could disagree with it. You could trash it. It doesn't matter to me. This is just kind of my way of doing things. And recognize this is not a ladder, meaning like you don't start here and work your way up. These are all tools that you can pull from whenever you feel like pulling from. Does that make sense? This isn't like you start with the topical and then graduate on the way up. Everyone gets topical in my practice, and then the girls just grab whatever they need, whether it's Pronox or pop a pill or do a nerve block. That's just like whatever fits the context. It's not a ladder that you start here, then you go here, then you go here, then you go here, and work your way up the ladder. Are we all clear on that? So after topical, it's just whatever fits the situation. Maybe you're just really exquisitely tender on the perioral lines, so there's no reason to like go up this ladder and escalate all this stuff. Maybe it's just this one little spot. So maybe I just dump a few lidocaine blebs just for that area to get you over that part, right? So all of these can be grabbed anytime you need them to fit the context. So, but the topical, let's start there. 23/7 lidocaine tetracaine. Make sure it's plasticized, please. Creams get absorbed and uptake really quickly, and their efficacy is not as good as plasticized. Plasticized is about the consistency of Vaseline. Think of it like that. And so it's more occlusive, which means slower, it sits on the skin longer and is more efficacious because of that. The uptake is greater over time. So you want a plasticized gel, not a cream. So make sure it's plasticized. You want to occlude when able, meaning like if it makes sense to occlude, like on a thigh, that makes a lot of sense to occlude. On a face, harder to occlude. Amazon, I've been told, does make like eye hole cutouts and mouth hole cutouts. Maybe it's someone. And when I say occlusion, guys, I'm talking about cellophane, like shrink wrap or whatever. What do you call it? Cellophane? Saran wrap, thank you. You take saran wrap, you put on your topical, and you put it under occlusion. The physiology behind that is, do you guys remember the old sweatsuits that you'd put on in the 80s and your pores open up? So when you occlude something, it doesn't breathe. You just put that cellophane on, pores open up, uptake is greater. It's hard to occlude someone's face. Maybe you want to occlude their face because they're that type of patient. I'll let you decide. But occlude where able, okay? 45 minutes is kind of the key that I found. There's no literature to support this at all. This is just personal experience. 45 is definitely greater than 30, and I don't know why it drives me crazy. 45 is definitely greater than 30. It's greater than 20. But interestingly enough, in my experience anyways, and I got no literature to stand on, but 60 is not greater than 45. Anything past 45 kind of seems same. So if 45 is greater than 30, anything past 45 doesn't seem to move the needle in the direction towards more numbing. Is that clear? So it's kind of like 45 minutes is the magic number. This is your max doses. I don't know what 5 grams means when I'm doing a topical. I can better kind of wrap my head around a 6-inch bead. So you squeeze it from a tube, about a 6-inch long bead is your max per treatment. That doesn't get you very far, does it? So if you're trying to do a whole abdomen, then we need to think of some different considerations, and that's step 1, 2, 3 here that we're about to go over. So this is your foundational topical. If you don't like 45 minutes because it's painful to wait, we use this machine called the CryoTouch. You can't charge extra for this. So it's not worthwhile from a business standpoint, but it does make it more efficient because I can numb quicker so I can get more treatments done in the same time frame, but I don't charge my patients for this. This allows me to, using the Bohr effect, Bohr uses pressure and temperature. I put my numbing in this little tube. This tube is hooked up to some nitrous or something that chills it. I can't remember the gas. And pressure. So the combination of temperature and pressure drives anything topical into the skin. That's just look up Bohr effect, B-O-H-R. And then actually, literally, we could numb this patient at 5 minutes, 5-minute application instead of 45 minutes. So, and it's the same efficacy at 5 minutes. It's so quick. And then we also, we can drive things into the skin. So we drove our post-procedure, whatever, fill in the blank, exosomes or your elastins, nectars, whatever you're using. This is immediately post-procedure. This is immediately after we use that CryoTouch to drive in some nectar or whatever our post-procedure topical was.